Assalamu alaikum everyone, this is Dr. Abdurrafi here and welcome back to the channel. Today we will talk about major Aphthous ulcers, so let's get right into the characteristics. The characteristics includes the size, which can be more than 10 mm in diameter. The common sites involves lips, soft palate, tonsillar areas and oropharynx. It can range up to 1 to 10 in numbers, and healing can be in 4 to 6 weeks, and it may heal with scarring. They can reoccur less than in a month. Moving on to the clinical features. There will be severe discomfort which will be due to the inflammation and burning sensation of the ulcers. Difficulty in eating and swallowing due to the same reason. And lastly, there will be a kettle-like ulcers with rolled margins indurated on palpation because of underlying fibrosis. This is the diagrammatic representation of ruled out margins, the fourth in the row. Now the causes of recurrent aphthous stomatitis. Number 1, hereditary predisposition, trauma, emotional stress, infective agents, allergic disorders, hematological disorders, gastrointestinal diseases, and lastly, hormonal disturbances. Now, if we talk about hereditary predisposition, a family history is found in up to 45% of patients. Next, trauma may precipitate and influence the site of some ulcers, but does not play an essential role in the etiology. Emotional stress can be a precipitating factor as well. Infective agents such as Streptococcus sanguis is related to the etiology. Other than that, allergic disorders like food allergy can raise the IgE levels. In hematological disorders, there can be iron deficiency, vitamin B12 deficiency, and folate deficiencies. Celiac and Crohn disease and gastrointestinal diseases and menstrual cycle can aid up into recurrent aphthous stomatitis. Now, histopathological features. There will be lymphocytic infiltration in lamina propria, which will be represented like this in this histological slide. Now moving on, that there will be infiltration that will comprise different subpopulations of T lymphocytes. Basically, there will be a lymphocytic infiltration in lamina propria first, and then the infiltration goes up to the epithelium, and then the infiltrate will start adding up to subpopulations of T lymphocytes as well. Which can cause immune-mediated cytotoxic damage to oral epithelial cells. And results in recurrent aphthous stomatitis. Now the diagnosis. Diagnosis is by three means. Number one, history. Number two, recurrences. And lastly, the blood indices such as MCV levels. MCV levels can fluctuate during the iron deficiency, folate deficiency, and B12 deficiencies. So the supplements will add up into the treatment. And moving on to the last part, that is treatment of recurrent aphthous stomatitis. Number one, you have to ensure and educate the patient to not to take spicy foods, which will add up into the burning sensation. We can give hydrocortisone 2.5 mg, which will act as an anti-inflammatory agent and will aid into reducing burning sensation. Number three, we can give triamcinolone dental paste for 3 to 4 times application per day. Number four, the most popular chlorhexidine 0.2% mouthwashes. It is preferred to use it 3 times daily after meals and held in the mouth for at least 1 minute. It will reduce the duration and discomfort of aphthous stomatitis. We can give topical salicylate preparations. It acts on anti-inflammatory action as well. Now the local analgesics, which include topical lidocaine or benzocaine sprays. They are more effective but can only be used in limited doses. Other than that, there are reportedly effective treatments include azathioprine, cyclosporin, colchicine, dapsone, and thalidomide. They are probably most reliably effective. Thanks for watching the video. I hope you learned something. Don't forget to subscribe the channel. Thank you.